I continue to be fascinated by the psychology of the patients I see in disability exams, and I've recently had some exemplary examples that I'm going to discuss today. Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. I've done over 1,500. As usual, everything I say represents my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, this video is primarily aimed at my medical colleagues. I'm in my 44th year of practicing medicine, and one of the reasons why I do Social Security disability exams is because I find the patient fascinating, and I continue to see diseases or injuries that I've never seen before in my career. And the first patient I'm going to present had a condition I'd never seen before in my career. The person had recently, in the past year, suffered a devastating illness that resulted in paraparesis, saddle anesthesia, and complete urinary and fecal incontinence. Really devastating disability. They'd gone from being perfectly healthy one day to being unable to walk without assistance the next. And this patient presented an interesting example of the psychology of a disabled person. First off, when I greeted them and asked how they were, they basically said they were fine. I find that's almost universal in seriously disabled people, both people who are disabled physically and people who are disabled from mental illness. In the past, I've discussed a patient I saw who had quite bad paranoid schizophrenia, who believed that everyone was plotting to kill him, and even at one point in the physical exam, thought that I might be trying to kill him. But when I first met him and asked him how he was doing, he replied, in essence, that he was fine. Second, the patient with the paraparesis was with a companion, and when I asked them to come back to the exam room, the companion offered to help them, but the patient refused help. The desire to maintain as much independence as possible is one of the hallmarks of truly disabled patients. As the medical history and physical exam proceeded, the patient exhibited three emotions. One was sadness. The patient was quite sad over the fact that they'd lost significant bodily function. The second was anger, but it's important to point out that the anger was directed towards their disease, not towards me, other healthcare providers, their companion, or other people, towards the disease. And the third was fear. The person feared for what would happen to them in the future. They were concerned about whether they would regain any of their lost function or not. Throughout the exam, they tried hard in range of motion testing, strength testing, and agility testing, although I was not able to do much agility testing. As it turned out, they could not walk at all without the assistance of their rollator. A rollator is a wheeled walker. Now I'm going to switch briefly to a second patient, a patient with a functional illness, who displayed a classic psychiatric presentation. Cheerfully and calmly, they told me that they were having horrific pain, dreadful distress. In essence, that they were suffering the torments of the damned while I was taking their medical history. It was a textbook example of LaBelle Ditheros. LaBelle Ditheros means the beautiful indifference, and this patient's cheerful and calm manner were in stark contrast to the horrible pains they were telling me they were experiencing. A classic sign of hysterical neurosis. Now, I know it's illegal to diagnose anyone with hysterical neurosis these days. In fact, doctors are supposed to not even know if patients possess hysters or not. But political correctness never trumps reality, and this patient had a classic manifestation of hysterical neurosis. The third patient was a more typical functional patient. When I greeted this patient and asked how they were, they told me that they weren't doing very well. An interesting thing is that there's a lot of websites for people who are applying for disability that are supposed to instruct the patients in how to behave in a disability exam so as to convince the doctor doing the exam that they're disabled. And these websites seem primarily directed towards patients applying for VA disability. I've looked at quite a few of these websites, and they tend to advise patients to give a negative greeting, such as, well, I wouldn't be here if I was doing well. And I think they're doing their clients a disservice, because I've found that's a hallmark of the functional patient. It's not 100% inaccurate, but it's a red flag that the patient is likely to be functional. The second red flag was that the patient wanted their companion to come back with them, supposedly because they would not be able to give an adequate history themselves, and their companion seemed to be infantilizing them. As it turned out, I told the companion that I would start with the patient alone, and if I needed them, I'd get them. And the patient was perfectly coherent, had normal memory, and was able to provide a complete and detailed history without any difficulty. The third sign of a functional illness was a lot of dramatic posturing, grimacing, and sighing. In particular, this patient displayed a pursed lips type of sighing. Now, I've seen a lot of disabled people and a lot of people in pain, some of it quite severe. I did work in a trauma center emergency department for 5 years, and one of the things I learned is that people in distress or pain don't tend to go. The next time you see a woman in labor, a person passing a kidney stone, or someone with a femur fracture, see how they behave and see if that's not correct. Next, this person made a suboptimal effort during the physical examination, and in particular, I had all patients seated and I asked them to dorsiflex and plantar flex their feet against resistance. I didn't provide any resistance for this patient. I just watched his feet and I asked him to dorsiflex them, and he didn't move them an iota. Now, if he truly had bilateral foot drop, he would have had a steppage gait. He would have had to lift his feet high to avoid tripping on his toes as he walked into the exam room, and he didn't have a steppage gait. So I knew that he wasn't trying. I pointed that out to him, and then he dorsiflexed his feet normally. Finally, he displayed my sign, the sarcastic laugh sign, which I coined 3 years ago. The sarcastic laugh sign is when I ask the patient to perform an activity and they laugh sarcastically and often make a comment like, "Yeah, right," as if that's going to happen. In this case, I was asking the patient to walk towards me on their heels. After giving the sarcastic laugh, I asked the patient to just try, and he was able to walk towards me on his heels without any difficulty. I hate to say never or always in medicine, but so far, over the past 3 years, the sarcastic laugh sign has proven to be the most accurate sign of functional illness that I know, and in my experience so far has been 100% accurate. The last patient I'm going to present was really interesting to me because it's one of the few people that I couldn't determine if their problems were functional or physical. When I'd read their records prior to the exam, it sounded like a functional illness, and that was what I was expecting when I began to see them. The first thing, they had a lot of complaints that sounded emotional. The first thing that struck me as off when I began speaking with them was they had a bit of exophthalmos. Then they told me that their hair had thinned considerably and they'd lost 70 pounds over 2 years for no good reason. Now, it's certainly possible to lose weight with psychological illnesses. Severe depression comes to mind, also anorexia nervosa. But 70 pounds is a lot, and this patient was distressed about their weight loss, unlike a patient with anorexia nervosa who had lost a lot of weight. They also told me that they developed frequent diarrhea. When I examined them, they had a resting heart rate of 120 beats per minute, and this was a youngish patient with no heart disease or any other problem that should cause tachycardia. As well, they had quite a marked tremor of their hands and feet. Now, I've found that a lot of functional patients will display a tremor, but it's an intermittent migratory tremor. They tend to tremble whatever part of their body the exam is focused on, and when focused on a different area, the tremor goes away. However, this patient maintained the same tremor throughout the exam. I'm sure you're thinking by now that I thought the patient might have Graves' disease, and I certainly did. There were 2 things against the diagnosis of Graves' disease. Number 1, they didn't have a goiter, and number 2, I asked them if other people were comfortable, did they usually feel hot or cold, and they told me they always felt cold. At the end of the exam, I just didn't know what was wrong with this person, and I decided that honesty was the best policy. So I talked a little bit about how psychological illness can present as physical and how sometimes physical illness can present as psychological. Told them that I wasn't sure what was going on with them, but I was worried about the possibility of Graves' disease and recommended that they consult an endocrinologist. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.